Hello guys, welcome back. This is your chapter 46. We're actually about to start unit 2. So just something really important for you guys to know about unit 2 is one of the most challenging units that you'll have in this course. So make sure that you take the time to learn the material, really grasp or and understand the different concepts that we'll be reviewing. We're gonna start our chapter or our unit by talking about the physiology of the autonomic and the central nervous system, and then the indications for the use of these drugs. Okay, so a little bit of introduction is that our nervous system is divided into two main divisions, which is your central nervous system and your peripheral nervous system. Your central nervous system includes your brain and your spinal cord, and your PNS includes all the neurons and ganglions. In the aspect of pharmacology, you need to understand that when we talk about CNS and when we talk about PNS, it is easier to understand how drugs actually work in your PNS versus your CNS. And remember, in the CNS, since it consists of the brain and the spinal cord, we really don't understand how drugs actually cross the brain, and as a reason, sometimes we don't have a real clear understanding of how the drugs actually work. With the PNS, it's a little bit easier because we have neurotransmitters and receptors that kind of let us know how the drugs actually get activated or inhibit, and how that actually generates different physiological processes in our system. We do have what we call afferent neurons, and these ones actually carry sensory input into the periphery to the CNS and modify motor output through the actions of the reflex arc. And then we have the efferent neurons, which again carry, but not this, they carry motor signals from the CNS to the peripheral areas of the body. So pretty much they'll let us move the way that we should be moving. The ganglia are nerve cell clusters that house cell bodies of the afferent nerves. And again, when we activate or deactivate these ones, they will either create something that we want, to create either movement or a certain process, or block it and then try to stop a process that may actually be harming your patient. The nervous system, in this case, the afferent part of your PNS has two subdivisions, which is your somatic nervous system and your autonomic nervous system. Your somatic nervous system, innervates in the skeletal muscle and basically controls voluntary movements. Versus, we're gonna talk about the autonomic system, and we're going to talk about the SNS and the PNS, and sorry, not the SNS, SNS and ANS, and we're going to actually talk about the different processes that occur through the activation of certain neurotransmitters. One really important thing that you need to understand also is selectivity. I kind of touched base on this on chapter 2 of our unit 1. And pretty much what we need to understand about this is that in the perfect world, we will want drugs to actually have selectivity, meaning that we will want them to just target the cells that we want them to target and not target different cells. Because the reason we have medications that create different adverse effects is because they don't only target the specific system that we're trying to target, but they may actually activate other organs, and that's the reason you see the different adverse effects. Um, by having selectivity, we are actually able to alter a disease process while hopefully leaving other physiological processes largely unaffected. So now we're moving to the autonomic nervous system. And the autonomic system pretty much involves all the involuntary activities of our smooth muscle, the secretory glands, and the visceral organs, of our body. And think about it almost like when you get really nervous, some of you guys get diarrhea. Well, that's what the smooth muscle comes from. You know, involuntarily your intestine starts moving really fast. When you get really nervous, you start sweating a lot, and this is when the involuntary activity of the secretory glands actually come into play. And then the visceral organs, such as the heart, you start getting your heart rate up. And like I said, it's just a physiological reaction. It is involuntary, but it usually happens because either you're in stress or, going through something. Acetylcholine and norepinephrine are the primary neurotransmitters for the autonomic nervous system. And the function of the autonomic system is actually to create homeostasis, help us through the stress response, meaning hopefully helping us to calm down a little bit or start freaking out, right, depending on what the reaction is, and then repair the body, okay? The sympathetic nervous system receptors, in this case, we have adrenergic receptors. And when we stimulate these receptors, we actually call them adrenergic effect. We have the same receptors, but when we actually block them, we can actually create an anti-adrenergic effect. The receptors for this system, we have muscarinic, we have dopamine, we have alpha and betas. We do have neurotransmitters that when we release them, physiologically speaking, or sometimes by providing giving the patient a medication that creates that effect, they will actually activate certain receptors. So for example, when the system actually releases acetylcholine, it actually activates the muscarinic receptors. When the dopamine activates dopamine, it only activates that dopamine. It's really selective. I almost, talk about dopamine as really snobby, meaning that it doesn't like to hang out with other people, and that's the reason they only activate dopamine. Norepinephrine activates alpha 1, alpha 2, and beta 1. And then the norepinephrine actually activates all the alphas and the betas. So this is where selectivity kind of comes into play, because if you think about it, if we give a medication that it has an adrenergic effect, most likely it will actually activate the different neurotransmitters that we're talking about: the acetylcholine, the dopamine, the norepinephrine, the epinephrine, unless they are selective, because we do have, like, we have beta blockers that are selective. We have alpha adrenergic drugs, they're a little bit selective, yada yada. Unless the medication, it actually has selectivity, it will actually activate different receptors in our system. When we activate the different receptors in our system, we can create physiological reactions such as increase in the heart rate, in the blood pressure, or in the cardiac output. The patient's blood glucose actually increases, the pupils dilate, the patient's metabolic rate it decreases, the blood flow to the brain, the heart, the skeletal muscle increases, and then the rate and depth of the respiratory rate actually increases. When we actually block these receptors, let's say that instead of activating or agonizing these receptors, we actually antagonize them, or we block them, or we inhibit them, we actually create the opposite of what you're seeing. So, like, let's say that you have a adrenergic inhibitor, and you will see a decrease in the heart rate, you will see a decrease in the blood pressure, you will see a decrease in the cardiac output. Instead of an increase in the blood sugar, you may see a decrease in the blood sugar. Instead of a dilation, you will see a constriction, and so on and so forth. I actually talk about this on the next video that that has to do with the nervous system. So I do suggest you to review not only this chapter video, but also you review the handout that I provided you, and also the explanation I gave about that handout, okay? Then we have the parasympathetic nervous system. The parasympathetic nervous system now produces what we call a cholinergic effect, because it actually hits on the cholinergic receptors. When we block it, then it actually creates an anticholinergic effect. The sympathetic nervous system receptor actually consists of muscarinic, and the easy thing about this system is that it only gets activated by acetylcholine. This neurotransmitter actually activates the different subreceptors, which in this case will be your muscarinic M, your muscarinic N, and your atropine. And the easiest way to remember like what will activate and what will not activate pretty much is when you talk about M, it will activate your muscles, and when it activates the N, it activates your nerve, or it will facilitate the nerve conduction. The physiological reactions that actually occur when we activate the parasympathetic nervous system, well, you'll see a dilation of your blood vessels in your skin. You will see an increase in your heart rate. You will see an increased secretion of your digested enzymes. So that means that you'll be able to digest food faster. Pupil will constrict. You will have a contraction of your smooth muscle in the urinary bladder, and then you'll see a contraction of the skeletal muscle. Again, if you have what we call an anticholinergic, right? Because we're saying that if we activate them, meaning if we create a cholinergic effect, this is what you will see. If you have an anticholinergic, an inhibitor, or an antagonist, right, you will see the opposite of here. So instead of seeing the dilation of your blood vessels in the skin, now you'll see a constriction. You will see an increase on the heart rate instead of a decrease on the heart rate. Instead of metabolizing food faster, now you're gonna metabolize food slower, right? Because now we're gonna decrease the secretions of those digested enzymes. Instead of seeing the pupils constrict, you will see them dilate, and so on and so forth. Again, if you can, or if you want, please don't forget to watch your nervous system handout video. I talk about this a little bit more in depth. It is a really important topic as we move forward to the other chapters.